Welcome back, everybody. We've been talking with Cindy Genrich here about Stylin for Pink, which is a fundraiser for breast cancer. We'll have the information for you again in just a little bit, but we want to shift gears a little bit and talk about what that means and what that feels like when the doctor gives you that word that you have cancer. Because that's, I can not even imagine how scary that would be, even knowing how great the treatment is these days.
Correct.
You know?
The good thing is I work with a lot of the nurse navigators that are in the local area at Swedes, OSF, and Rockford Health System. So once a woman's diagnosed, they usually take her, get a team together, and kind of talk to her about what treatment she's going to go through. The huge panic is losing their hair and what's going to happen. Because life goes on even though you have cancer. So it may be a wedding, there may be an event, something coming up, and you don't want to be sitting there saying, hi, I'm going through treatment. So the number one thing to do is, once they're diagnosed, is to set up a consultation, because usually 99% if you're going through chemo for breast cancer, you will lose your hair.
Okay, so you set up a style consultation.
Yes.
Okay.
Yes.
Interesting.
Okay. Hair color is many different colors nowadays. If I would have brought a color ring, it's got like hundreds of colors for them to choose from. And the idea is to get hair, whether it's human or synthetic, to be your hair color, so to feel like you.
So you don't, like, so for example, if I lost my hair, I wouldn't suddenly go red. You know what I mean?
No.
You get the same color.
Because it's an emotional journey.
Yeah, you want to still
And
look
the
like
last
yourself.
thing you want to do is walk by the mirror and say, why did I do that? I've never had red hair.
Me.
That's not me.
Yeah.
So you want things as normal as possible. So you also can contact your insurance company. What happens, what they call it, you need a cranial prosthesis.
Okay.
A cranial prosthesis replaces cranial hair.
It sounds so medical and technical
to
describe a wig, but you know.
It is. Because insurance companies, some can be very good about it. Some can say, well, we don't cover because the hair will grow back. Once the treatment stops, it'll start to grow again. But it's very emotional for the woman going through it, because she wants her hair. She wants things normal. She wants to be able to have her picture taken with kids.
And it's not just vanity. I mean, your emotional health affects your physical
health,
does it
everything.
not? So it's very important.
It's very important.
Yeah.
So once they make a consultation, I take them through and tell them everything that they need to do. Contact your insurance company. It is an out-of-pocket medical expense once you have a prescription. And then we order in the hair, and we cut it and style it so that you feel like yourself, that you're not walking around. Usually it depends. Usually about 2 weeks after you start chemo, the hair will start to come out. You may get a tingling feeling on your scalp. Sometimes it gets a little tender. Sometimes it starts to feel like, I call it coated chemo hair. And it gets kind of nasty. So the key is, once it's starting to go, to get it off your head, and it actually will feel better when the hair is gone.
Just shave it right off?
Right.
Wow.
Right. Or cut it really, really short so it can just fall out at that point.
Okay.
And then once you get your hair on, and you can get through what life is going to bring you down the journey. And it's that good comfort of feeling good, looking better, and knowing that somebody isn't pointing out, oh, somebody going through treatment.
Right.
You know.
Not that someone would look down on you for that. You know? And every once in a while I'll see someone out in public who clearly is and is not covering it up, and I think that's awesome too, that they feel comfortable enough to do that.
Exactly.
A lot of women wouldn't.
Correct. And it depends on your situation. If you are in a profession where you call on clients and you're in a position where you meet people, you necessarily want to feel and look like yourself than to have being questioned about what's going on, because you do want life back normal. You don't want to, you're dwelling on it enough at night when your mind's running, you know. But the good thing about it is temporary. And once you get off the chemo, the hair will start to grow back.
How long does that process take?
It takes a while. If, say for an example, your hair would grow 1/4 of an inch, 1/2 inch per month, that's how it's going to be coming back. So it is a few months
okay.
that you may still continue to wear your hair until you get at a comfortable point.
Until you have at least enough for like a pixie haircut.
And you know, it can come back a totally different texture too.
Really?
Yes.
Oh, that's interesting.
Sometimes it can come back really wavy. I had one gal that came back one side straight and one was wavy, and I said, well, which one do you want? So we permed the other side.
Oh, I didn't know your head could do that.
Yeah, and other areas it can make totally different color. So it's kind of a surprise coming back.
Yeah, that's interesting.
Down the road, once the hair comes in, I always get a phone call, can I color this? Yes,
okay.
You've had it a period of time.
So you can always get it back to whatever you had
yeah,
before.
Yeah, exactly. It just may be a different consistency. Some people had really thick hair before, but when it came back, it's really thin.
Why is that? Why does it come back so differently? Does the chemo actually like change the shape of the follicle, or what's happening?
You know, I think it could be a combination of the drug
okay.
itself. Everyone's body can react differently. Yeah. There's no exact remedy why it does. For an example, if you've colored your hair before and say it was gray, it's probably going to come back in the gray or a white.
Okay.
But I've had other people say my hair came in darker.
Okay.
So there isn't
whatever.
a perfect, you know, it's kind of like gambling here. You don't know what you're going to get.
Yeah. Being a stylist too, we need to take a quick break, but being a stylist, I want to ask you after the break how makeup affects the woman too, and how important that is in the whole process of just feeling like yourself and feeling like you're healthy. So we'll touch on that when we come back.